Hey guys, I'm Dr. William Summers, and I want to thank you for watching the 6th video, part B, in my series, Weight Management, A Class with ACT. We have been discussing GLP-1 medicines, and there are some common adverse events or side effects I want to discuss. Nausea is most common and can be up to 40% of patients in clinical trials. It is more common in the beginning and when dose increases occur, and most prescribers familiar with these meds lower the doses to smaller amounts, off-label doses, to help you get used to it. These GI issues occur probably less than 10% in my patient population. Nausea may occur because these medicines help slow stomach emptying, which helps with feeling full longer. But this slow emptying can cause nausea. I prescribe promethazine, Phenergan, or ondansetron, Zofran often, but only after first talking to any patient experiencing these symptoms to be certain these symptoms are only dose-related. If for any reason someone seems clinically more affected, or there is any abdominal or epigastric pain, I will insist on an amylase and lipase, pancreas enzyme blood test, before any future dosing is allowed. The blood test to me is vital if there's any suspicion for anything more than that dose is just too high for you. I tell my patients I will not charge them to come in for lab. I will bill their insurance, but if their insurance doesn't pay for that test or they had no insurance, I will pay for that test. Safety first. This diligence ensures safety. Constipation is the second most common adverse event that may occur with any of these medicines mentioned above. And I advise patients to increase fiber, and I often recommend over-the-counter polyethylene glycol powder, known as Miralax, if necessary. But again, adjusting the standard dosing increments can be helpful here. Diarrhea is third most common. Dosing adjustments helpful here. Reflux, indigestion, GERD are all common side effects. First, if a patient is already on prescribed medicines indicating they are already dealing with reflux, I often recommend calcium carbonate, Tums, or over-the-counter H2 blockers like famotidine, known as Pepcid, or over-the-counter proton pump inhibitors, Meprazole, known as Prilosec, to assist with any of these symptoms. And dose adjustments are helpful here. GI doctors will tell you weight loss is the best medicine helping long-term GERD. Vomiting is less common, and again I prescribe antiemetic medicines and have a low threshold for checking those Pancrealab amylase and lipase enzymes. There are common injection site reactions which I am comfortable if the reaction is not getting larger with subsequent injections and not exceed the size of a quarter. If a patient has this minor allergic reaction on one medicine and I feel I should stop it, I have found they may tolerate another branded medicine without incident. In 13 years prescribing these medicines, I have never seen a serious allergic reaction. A rare few have been reported, and that is true with any medicine. So summary, GI symptoms are common, and I inform my patients they are. Slow dose titrations can be your friend here. These meds work on the pancreas. Pancreatitis is serious, and patients with pancreatitis are likely admitted to the hospital and likely go to the ICU. There is significant mortality associated with pancreatitis. I take this rare but potential serious side effect super seriously, and this is why. If I have any suspicion, I will ask the patient, come to the office ASAP, check labs. I have checked hundreds of blood tests on patients I felt indicated from thousands of patients. I have found 5 patients with an elevation in lipase or amylase and immediately stopped the medicine. I did not start another brand in the same class. With early detection, not one of these patients went to the ER or had to have IV fluids, and certainly did not get admitted to the hospital. Careful observation and keeping a low threshold for checking labs helps me sleep well at night. I give my patients instructions on how to inject their meds, but a great resource here is each pharm company has a demo for their branded medicine on YouTube. All different manufacturers' injection pens are different, and these visual demos supplied by their makers are great. Let me add here, the medicine in these pens goes to buttons to work until it is broken down. They do not go in the bloodstream and disturb other medicines. They do not go to the liver and disturb processing and eliminating other medicines, nor do they go to the kidney to mess with anything there. This is the first group of medicines that I have come across in 35 years that I can say there's no drug-drug interaction. They do not lower blood sugar. They stabilize sugar, except possibly with two situations. If you are on insulin, this combination can cause hypoglycemia, especially with weight loss where insulin demands will be lower. And two, for patients taking the group of medicines called sulfonylureas, glimepiride, glipizide, glargine. Sulfonylureas are older medicines commonly used to treat patients with type 2 diabetes. They are cheap and help regulate sugars well. But while doing so, they cause belly fat, and the Board of Obesity recommends stopping these medicines in exchange for diabetic medicines that help with weight loss. Last, and about the kidney. These medicines have no direct negative effect on the kidney, but patients who have pre-existing kidney disease could have nausea and vomiting, which could produce dehydration. And dehydration is not good for the kidney. I have been seeing patients with weight gain issues for decades, and for so long, it was like being locked in a room, fumbling keys that didn't work, trying to unlock a door that couldn't be found. My excitement and passion about having the right keys and doors is off the chain. With health style changes, using these medicines, there are game changers. But health style changes, seeking a higher quality of life is first base. In my love of quotes, Hippocrates said, "The greatest medicine of all is teaching people how not to need it." Thanks for watching Part B, Video 6, Weight Management, A Class with That. Thanks so much.